Our minimally invasive surgery unit is a multidisciplinary clinic where we have specialists from reproductive endocrine, urogynecology, oncology, benign OBGYN, and minimally invasive surgery that have a specific fellowship for that type of surgery, where patients are seen collaboratively. And our basis is we want the right procedure for the right patient by the right provider.
One of the advantages of the center is that by having multiple surgeons who have each specific and unique training, we can bring that together for the benefit of the patient. So there's a real willingness to work collaboratively with each other in a minimally invasive fashion for the benefit of that unique patient.
Patients who may be deemed inappropriate at other institutions for this approach, we often will evaluate in a group type setting with more than one physician or surgeon evaluating the patient to come up with an optimal approach, which is 90 to 95% of the time able to be completed through a minimally invasive approach.
So over the years, things have gone to doing small incisions through the abdomen. And over the years, I've seen so many different things. The technology has gotten so good and our skill set has gotten so good that we can do a lot of procedures that people historically have relied on their parents to tell them that could be done.
We're able to offer the full variety of minimally invasive gynecologic surgery options for patients. We do have robotic as well for patients who need that extra technology in their surgery.
Patients that are considered very difficult out in the community for a minimally invasive approach or would have had an open abdominal or laparotomy incision are filtered down here so that we, within the department at Mass General, are doing the most complicated cases in the region that are all filtered through the satellite clinics.
We just kind of started doing research on the MGH website. I asked about Dr. Brown and they said they thought it was a great idea for me to have a consultation with him. So I had the MRI and then I saw Dr. Brown. He was incredibly confident in his opinion that this procedure could be done laparoscopically. The surgery itself was, I think, about, 5 hours or so. But I was amazed at how little pain I had, and within 2 days after the procedure, I was not taking any pain medication. I was going up and down stairs. I was back to work within 3 days.
So whether the patient has multiple comorbidities such as obesity, prior heart disease, other medical complications, or is complex surgically, meaning they've had multiple prior laparotomies, they may have cancer, they may have incontinence, they may have prolapse, they may have an enormous uterus, or even stage 4 endo. All of those patients are to be considered for a minimally invasive approach at Mass General Hospital.
We have Harvard medical students, we have residents in obstetrics and gynecology residency, we have numerous fellowship trainees including GYN oncology fellows, reproductive endocrinology and infertility fellows, urogynecology fellows. So we're very proud of our ability to offer them experiences, and that's another way that we help to foster an understanding really across the country with regards to the utility of these minimally invasive approaches.
We're on a trajectory, and I think what we're doing here at Mass General is that we're moving the bar a little bit further every single day in terms of what we can do safely, how we can accomplish that with optimal surgical outcomes, and all of this along a minimally invasive approach. What I'd like to see is that we increase the percentage of surgeries that we do minimally invasive. We're already very high at 90 to 95%. I'd like to see that increase. I'd also like to see us expand our training efforts and ongoing developments with expanding the center, the division for minimally invasive GYN surgery, and adding fellowship trainees here at Mass General Hospital so that we can train the next generation of minimally invasive surgeons.